If you are currently studying to become a CRCST, you do not have to do it alone. I do have a 3-month program that is designed to help you pass the exam. I have helped numerous individuals obtain their CRCST certification, as well as finding a place to fulfill the 400 hours by way of employment. So if you need help with preparing for the exam and you want more than just being able to read the chapter or listen to the chapter online, you are more than welcome to join me. I have an online program that works for all 50 states. In California, or you live in New Orleans, or you live in Texas, or you live in New Jersey, or you live in New York, I can definitely help you obtain the certification and pass the CRCST exam. All right, so Chapter 1, Introduction to Sterile Processing. Like I told you guys, start with the learning objectives. As a result of successfully completing this chapter, the reader will be able to, 1, explain the importance of sterile processing department with an emphasis on the service provided and the role of sterile processing in quality care. 2, review the workflow process in an organized sterile processing department. 3, identify basic knowledge and skills required for sterile processing technicians. 4, define job responsibilities of sterile processing technicians. And then 5, discuss the role of education and training in the field of the sterile processing profession. So those are the learning objectives for Chapter 1, and I urge you guys to read them when you get a chance, or when you read the chapter. And I want to make a little quick disclaimer. I don't want you guys to replace actually reading the chapter to listening to me read the chapter. This is going to be more so as a extra. So like when you just want to review the chapter, maybe you're cleaning up, maybe you I don't know, you're working out at the gym, who knows, and you just need a refresher after you've read the chapter. That's my recommendation, but y'all grown, so you can do what you want to do. But anyway, let's get started. So we're going to start with the introduction. So the majority of medical procedures require the use of supplies, instruments, and/or equipment. Some items are used once, then discarded, while others are used multiple times. Reusable items must be thoroughly cleaned, inspected, disinfected, and/or sterilized before they can be used to treat other patients. The Sterile Processing Department, or SPD, in a healthcare facility performs these important reprocessing activities. Medical technology is rapidly advancing. The medical devices used in the operating room and throughout the healthcare facility have changed dramatically over the years. As these devices become more complex, the same can be said of the methods required to reprocess them. Like the entire medical field, sterile processing profession has evolved significantly. The advances experienced in patient care or patient treatment care have come with advances in the medical devices used to process or to provide those services. Today's increasingly sophisticated medical devices require more complex handling and reprocessing, which has resulted in many changes for sterile processing technicians. These changes have not happened overnight, but have been introduced steadily throughout the past years. For example, one need only to look back a short time to identify changes that have enabled increases in minimally invasive surgery, or MIS. These procedures provide many benefits to patients, including shortened hospital stays, smaller incisions, reduced trauma, and shorter recovery times. These procedures require complex instrumentation, which requires complex processing protocols. Medical technologies will continue to advance, devices will continue to become more complex, and sterile processing technicians will be required to keep up with these advances. This chapter will introduce the field of sterile processing and provide an overview of the knowledge and skills required to meet the demand for timely, safe, and functional medical devices. So we're going to learn a little bit of everything about sterile processing in this one chapter. We'll talk about the workflow, we'll talk about decontamination, assembly, and sterile storage. So you're going to get a broad overview of the entire field. So let's get started. Let's start with the one-way workflow. SPD is the central location for the delivery of soiled or used medical devices and the distribution of clean and sterile items. In order to provide a safe working environment, facilities should implement processes and procedures with specific workflows for medical devices to help ensure safety. Soiled materials must be isolated from their clean counterparts to ensure acceptable processing conditions. A one-way flow of materials from soiled area to the clean area and onto the sterile storage area is required. To facilitate one-way flow of goods and maintain distinction between soiled and clean work areas, physical barriers or walls are used to separate the functional areas of the SPD. These areas include decontamination, preparation and packaging, sterilization, and sterile storage and distribution. All right, let's start with decon. Decontamination is the physical or chemical process that renders an inanimate object, such as a medical device, that may be contaminated with harmful microbes, safe for further handling. The decontamination area is where all soiled instruments from the OR are received, along with other items such as medical equipment. Instrumentation and medical equipment can be collected from different places within the healthcare facility. For example, labor and delivery, the emergency department, and patient care units like ICU. But when medical devices are received, they must be properly sorted, disassembled, and cleaned using established protocols. All items returned to the decontamination area are considered contaminated and potentially infectious. Decontamination is an important process because items cannot be considered sterile or high-level disinfectant if they are not effectively cleaned. Therefore, cleaning is the first step in the sterilization process. An effective cleaning process may be accomplished with manual and/or mechanical cleaning techniques. Sterile processing technicians must have an in-depth knowledge of the items to be cleaned in this area and must select the appropriate method of decontamination as recommended by the device manufacturer. After thorough cleaning, many items in the decontamination area will be sent to the preparation and packaging area for further processing. There's a couple of definitions on this page that you guys should be aware of. So we went over decontamination and cleaning. The technical definitions for decontamination include, or is, to make safe by removing or reducing contamination by infectious organisms or other harmful substances to an acceptable level. And then next we have cleaning, which is the removal of all visible and non-visible soil and any other foreign material from medical devices being processed. All right, moving on. Working in the decontamination area requires a thorough knowledge and understanding of microbiology and the decontamination process. Sterile processing staff must be able to identify and clean a wide variety of medical devices. Knowledge about cleaning and disinfecting agents and their use is critical. Protocols for waste disposal, transportation of contaminated items, and operation of equipment used in the cleaning process, including washers, disinfectors, ultrasonic cleaners, cart washers, steam guns, and specialty washers is required. Sterile processing technicians working in the decontamination area must be protected from the environment. The physical layout of this area, as well as the cleaning and equipment used in it, must meet the appropriate standards for governmental agencies and the recommendations of professional organizations. Policies and procedures must be developed and followed to ensure that the work practices minimize employee injury and exposure to pathogens, to meet the Facilities and Occupational Safety and Health Administration, or OSHA, safety requirements. Sterile processing technicians must wear special attire called PPE, or personal protective equipment. PPE minimizes the exposure to bloodborne pathogens and other contaminants. PPE includes a fluid-resistant face mask, eye protection, a fluid-resistant cover gown, general-purpose utility gloves, and a fluid-resistant shoe cover. All right, that's decon. Let's move on to preparation and packaging. So after items are safe for handling, they are delivered to the prep and pack area of the SPD. Each item should be carefully inspected for cleanliness, proper function, and possible defects. Instruments and other devices should be inspected, packaged, and labeled in preparation for sterilization. Sterile processing technicians must be able to identify thousands of surgical instruments. That's right, that's not a joke. We have to learn a lot of instrumentation. And as somebody who's been in this industry for quite some time now, there are still instruments that I don't know to this day. So don't expect that you're going to know all of the instruments, because you just possibly can't. Especially if you're working at a particular hospital that only specializes in certain procedures. And let's say that you're spending a whole lot of time at that hospital, so 1 year plus. Let's say that you spend at least 5 years at that hospital. You're not getting to work with different instrumentation because this one hospital is only doing orthopedic, general, GYN, okay? So you have, and that's one of the reasons why it's okay and it's good to move around to different hospitals, because you can learn, it'll make you a more seasoned professional, because you'll learn more. And you can do that once you become a traveler, instead of, getting hired at multiple facilities and having them think that you're going to be a staff employee and they can count on you. I would suggest becoming a traveler so that you can learn more. That is what I did when I first got into this industry. I worked at a hospital for 1 year, and after that, I did some traveling, and that is where I learned the bulk of everything that I know now was through traveling, because I was able to go from one hospital to another, and I learned so much during that process. Moving on. So the last thing I said was sterile processing technicians must be able to identify thousands of surgical instruments. They must understand how instruments are manufactured, how they are constructed, how to test them, and how to best maintain them. It is essential that sterile processing professionals have the knowledge and training to maintain instrumentation properly, consistently, and safely. Okay. Surgical specialty instruments, equipment, and implants also require special knowledge and expertise. Sterile processing technicians must be able to select the proper packaging system and use proper techniques for packaging items for sterilization. Okay, moving on to sterilization. Remember, I told you we're going to go through each section. This is going to be a general overview of each section of our department. Okay, so next we have sterilization. Items to be sterilized must be properly identified, and the correct methods and parameters for sterilization must be followed according to the manufacturer's instruction for use. What is an instruction for use? An instruction for use is information provided by the device manufacturer that provides detailed instructions on how to properly use and or process the medical device. Okay. The principles necessary to achieve sterilization must be understood and applied. Sterilizers must be loaded and operated properly, and sterilization quality assurance measures must be followed to help ensure the sterilization parameters have been met. Records must be maintained, and sterile processing technicians must be aware of factors that can that can compromise sterile packaging. What is the technical term of sterilization? So, sterilization is the process by which all forms of microbial life, including bacteria, viruses, spores, and fungi, are completely destroyed. Personnel working in the preparation and packaging and sterilization areas of sterile processing must wear facility-required attire such as a scrub suit and hair coverings. So, to my people, my ladies, who you thought you were going to go get your own cute scrubs, this is not the department for that. You have to wear hospital scrubs. Now, you may be able to get away with wearing your own scrub cap, and maybe a badge accessory, which I have both coming out soon. I have some cute designs, and I have a badge accessory that I'm getting ready to release. They're in production right now, and I'm super excited about that. But that's pretty much the only thing that you're going to be able to customize and how to make your uniform cute. And I know how it feels because, I've been doing this for some time now, and I don't get to wear the cute scrubs and all of that stuff. But again, you can wear cute badge accessories, and cute shoes. Cute shoes will put together those sometimes ugly, because sometimes they're cute, but those sometimes ugly surgical scrubs that the hospital provides, you can jazz it up with putting on shoes and having some cute stud earrings, and maybe a badge accessory and a scrub hat. But unfortunately, ladies and gentlemen who enjoy, looking nice and stuff like that, we have to wear hospital scrubs, and it's for good reason too. And we'll talk more about that when we get to that chapter, infection prevention. But where did I leave off now? Okay. It is essential that sterile processing technicians diligently adhere to dress code and safe work practices to protect the environment from contamination. Okay. Let's move on to sterile storage. All right, so sterile storage and distribution. This is the supply area of the sterile processing department, and it is dedicated to the storage of sterile instruments and clean or sterile supplies. It is a separate area for removing supplies from shipping cartons and containers, and this is also provided. It is the major portion of the work area, the major portion of this work area involves receiving, storing, and dispensing supplies and sterile instruments. While items may be dispensed to almost all departments within the healthcare facility, the major focus area is servicing the operating room. This is usually accomplished using a case cart system. The bulk of surgical supplies may be stored in a central location. A dependable system must be in place to supply items to surgery from the sterile storage area. Surgical procedures are usually scheduled through a surgery scheduling office using a special computer program. When surgical procedures are scheduled, authorized personnel assign a case card or doctor-physician's preference card to each procedure. This generates a case card pull sheet or pick list that identifies items specific to the doctor and procedure. Sterile processing technicians use this sheet to place supplies from the sterile storage area onto the case carts that transport these items to the appropriate operating room surgical suite. Personnel working in this area usually gather instruments and supplies needed for all surgical procedures during the day or evening before the surgery or before they will be used. Other areas within the healthcare facility may be supplied from the sterile storage area. Also, facility personnel from different departments frequently require items that are only available in sterile processing. Those working in the sterile storage area must be familiar with all supplies within the location in order to provide fast and accurate customer service. It's going to be imperative when you're working in the sterile storage area that you learn where everything belongs, because that is going to make or break whether or not you're able to give efficient and accurate patient care. So if the operating room calls and they say, we need this set, you need to know where that set lives so that you can provide them with that tray that they're requesting. So open lines of communication must be maintained between those in sterile processing and sterile storage areas to help ensure that an adequate stock of sterile items is always available. Also, the supply chain management department is an important link in the supply process. Therefore, the effective communication and problem-solving skills must be fostered between personnel in these two important departments. There's quite a few definitions on this page. That includes case cart system, case cart doctor-physician's preference card, case cart pull sheet, and supply chain management. What is a case cart system? A case cart system is an inventory control system for products, equipment, typically used in an operating room that involves the use of an enclosed or covered cart. This is generally prepared for one surgical case and is not used for general supply replenishment. Next, we have a case cart. We know what a case cart system is. So what is a case cart? So a case cart is a cart prepared for an individual procedure. Case carts usually contain all instrument supplies and utensils needed for a specific procedure. What is a doctor's physician's preference card? This is a document that identifies a physician's needs, requests, and preferences for a specific medical procedure. Preference cards usually contain information regarding the instruments, equipment, supplies, and utensils used by a specific physician. This may also include reminders for the staff and of the physician's preferences regarding patient draping, instruments, and supplies. So this, the doctor's physician's preference card is the document that you would use when you are picking cases for a surgical procedure. Okay. Next, we have a case cart pull sheet or pick list, which is a list of specific supplies, utensils, and instruments for a specific procedure. Sterile processing technicians use these lists to assemble the items needed for individual procedures. Then we have what is the supply chain management? So that is also a department that a lot of individuals who are looking to get into healthcare, but you don't necessarily know which way you want to go. Supply chain management is also a good industry to get into, and they work extremely close with the sterile processing department. So a lot of my coworkers have transferred from that department into sterile processing. So essentially, supply chain management, then sterile processing, and then surgical tech, and then nurse, whatever. That is usually the route that people take. Anyway, but personnel working in, okay, I already read that. Did I? I don't think so. Personnel working in the sterile storage area must have thorough knowledge of every item, how it is used, where it is located, and the process for obtaining it. Other knowledge and skills include those needed for inventory control and supply distribution, surgical specialties and procedures, sterile storage and handling requirements, computer systems relating to inventory and case cards, acquisition and disposition of supplies, resolution of supply problems. All sterile processing areas must exercise careful environment control conditions. Each work area should be restricted to assigned and authorized personnel who consistently follow the facility's dress code policies. Strict traffic control patterns must control the movement of people and goods through the department. Air pressure levels must be maintained to control air movements. Proper air pressure controls and prevents the flow of bacteria-laden particulates and dust from soil to clean areas. So that is the main reason why we practice the one-way workflow. We want to keep the dirty with the dirty, and we don't want any of those contaminants from the dirty coming in contact with the clean areas of sterile processing. So next, we'll talk about the ancillary areas and equipment. So SPD performs the primary medical device processing for the healthcare facility. Specialty procedure carts such as isolation, urology, and emergency carts can be processed by the SPD. These specialty carts are cleaned, inventoried, and restocked between patient use and may be stored in sterile processing areas until needed. Other patient care equipment, including such as IV pumps, can also be processed and stored in the department. Loaned instruments are brought in for a specific patient procedure for evaluation of new technology or to use while existing devices are being repaired. There should be a designated location and processes for receiving, processing, distribution, cleaning, and return of loaned instruments. Now, next we're going to talk about the processing cycle. The processing cycle is basically the life cycle of these inanimate objects, if that makes sense. So these objects go from clean to dirty, essentially. They go from clean, assemble, sterile, dirty. Okay, there's a couple of steps in between that, and we're going to talk about them in detail. So work performed in the SPD usually follows a processing cycle. After use, items that can be reprocessed are returned to the decontamination area to start the process all over again. It is important to note that at each step in the process, items are inspected to ensure that they are clean, in good repair, assembled, and processed correctly. So the cycle starts at clean. It moves to inspect, which would be dirty, assemble, package, sterilize, inspect, store, inspect, dispense, and then it starts all over again. Okay, so sterile processing technicians not only master specific skills in each work area, but they also learn new ones as technology, regulation standards, and best practices evolves. Okay, so a basic educational foundation is needed to work as a sterile processing technician, and I understand that the HSPA allows you to study for the CRCST exam in a couple of different ways. So of course you guys know that you can self-study, take a course, or you can use your own work experience, but you do need to have some level of understanding of this good textbook right here. So numerous dimensions of knowledge and skills are required for sterile processing technicians to be successful in their jobs. A basic educational foundation is necessary to form the base for more specialized knowledge and skills. Examples of these skills include the ability to read and write, including the use of reports, manuals, and IFUs. Communicate clearly with inter and intra-departmental team members. Interpret technical materials used for sterile processing practices and procedures. Understand concepts of microbial transmission and infection prevention. And then understanding use surgical and medical terminology. That's a big one. That is the reason why we have to learn microbiology and medical terminology. And that is the reason, and this is the reason why, is because we are reprocessing surgical instrumentation, and the verbiage that is used in that department is medical terms. So if they are talking to you about a specific procedure and they're using these terms that you have no awareness of, it's going to be hard for you to communicate in our department. Okay, so if they start talking about a laminectomy, then you already should know that they are speaking about they're going to need spinal instruments. Okay, anyway, so some basic job skills and knowledge that you need to be a professional sterile processing technician include communication, facility systems, or understanding the facility systems, employability skills, legal responsibilities, ethics, safety practices, resource management, and that is it. So I'm going to go through each one. So for communication skills, sterile processing technicians must know alternative methods of providing and obtaining information. They must be effective verbal and written communicators. To do so, they must be able to assess the ability of other people to understand what is being communicated, adapt the communication style to individual needs, apply active listening skills using reflection, restatement, and clarification techniques, interact appropriately and respectfully with diverse groups in numerous situations, communicate in a manner that is straightforward, understandable, accurate, and timely, use facility-specific guidelines and methods to send and receive information, and then access and use electronically produced information. That was a whole lot. All right, moving on. Facility systems. Sterile processing technicians must understand how their role fits into their department, their organization, and the overall healthcare environment. They must be able to identify how key systems affect the services they perform and quality of care that they provide. To do so, they are aware of the range of services offered to customers. They prevent unnecessary waste and duplication. They participate in quality improvement activities, and they use other resources, including staff members and training opportunities. That wraps up facility systems. We'll move on to employability skills. Successful sterile processing technicians use employability skills to enhance their employment opportunities and job satisfaction, and they maintain and upgrade those skills as required. Examples include maintaining appropriate personal skills, such as attendance and time management, maintaining professional conduct skills, using analytical skills to solve problems and make decisions, formulating solutions to problems using critical thinking skills independently and in teams, adapting to situations, practicing personal integrity and honesty, engaging in ongoing self-assessment and goal modification for their personal and professional improvement, exhibiting respectful and empathetic behavior as they interact with their peers, superiors, subordinates, and customers, listening attentively to verbal instructions, requests, and other information. Okay, that's employability skills. Legal responsibilities. Sterile processing technicians must understand and maintain the awareness of the legal responsibilities and limitations and the implications of their actions within the healthcare delivery system. To do so, they must comply with established risk management factors and procedures, determine when an incident must be reported, maintain confidentiality, operate within the required scope of practice, follow mandated standards for work safety, and comply with legal requirements for documentation. Okay? All right. Moving on to ethics. Ethics relates to knowing the difference between right and wrong. In the healthcare environment, it means conforming to accepted and professional standards of conduct. Ethical behavior is doing the right thing in the right way. Ethics should guide the way sterile processing technicians act and make decisions. They must always respect the patient's right, promote justice and the equal treatment of all individuals, recognize the importance of patients' needs over their other considerations, report any activity that adversely affects the health, safety, or welfare of patients, visitors, and fellow workers, Comply with regulatory guidelines, facilities, policies, and departmental policies and procedures. Respect differences among team members, and demonstrate professionalism when interacting with customers and coworkers. Next, we have safety practices. Successful sterile processing technicians understand existing and potential hazards to patients, coworkers, and themselves. They prevent injury or illness through safe work practices, and they consistently follow health and safety policies and procedures. They do so as they practice infection prevention procedures, use standard precautions to control the spread of infection, practice appropriate cleaning, disinfecting, and sterilizing protocols, apply principles of body mechanics, identify and report fire and electrical hazards, use equipment properly, follow emergency procedures and protocols, and comply with regulatory guidelines. In my reading, I mentioned standard precautions. That is something that you definitely are going to hear a lot when you begin your journey as to becoming a CRCST. So what is standard precautions? Standard precautions is the method of using appropriate barriers to reduce the risk of transmission of bloodborne and other pathogens. This standard applies to all patients regardless of diagnosis or presumed infectious status. So regardless if something looks dirty or it looks clean, if you know the status of the patient, if you don't know the status of the patient, this is all the more reason to practice standard precautions. You're going to use either gloves, fluid-resistant gown, shoe covers, face mask, face shield, whatever you have to do to protect yourself from, receiving an infection or an infectious disease. Moving on to resource management. Sterile processing technicians must understand the role and responsibilities of individual members as part of the healthcare team. Examples include controlling cost and reducing waste, providing quality service, practicing time management skills, identifying and solving potential problems, using inventory appropriately. Other skills are also required of sterile processing technicians. For example, they must practice established policies and procedures to prevent healthcare-associated infections, or HAIs, keep their work environment clean and organized. New healthcare roles demand higher level of skill than ever before for those working in sterile processing. The complexities created by technology continue to grow, and a new generation of healthcare professionals is emerging. Healthcare-associated infections include an infection that is not present when a patient is admitted into a healthcare facility. If the infection develops in a patient on or after day 3 of admission to the healthcare facility, the infection is referred to as an HAI. What are some basic job responsibilities? So, sterile processing technicians are accountable for many tasks. Job descriptions are used to define and communicate job duties and requirements to employees within an organization. They are intended to be overviews that capture the general purpose and major accountabilities of a job, and they are used for the following reasons. They are used to evaluate positions and determine compensation, to clarify expectations, and to review performance. Because sterile processing departments vary in size and scope of service, and jobs within SPD vary, there is no single job description that applies to all situations. If you are currently studying to become a CRCST, so that you do not have to do it alone. I do have a 3-month program that is designed to help you pass the exam. I have helped numerous individuals obtain their CRCST certification, as well as finding a place to fulfill the 400 hours by way of employment. So, if you need help with preparing for the exam and you want more than just being able to read the chapter or listen to the chapter online, you are more than welcome to join me. I have an online program that works for all 50 states. You live in New Orleans, or you live in Texas, or you live in New Jersey, or you live in New York, I can definitely help you obtain the certification and pass the CRCST exam. So whenever you are ready to get started, please head to my website. It's www.thesterileprocess.org, and that is where you can find all information about the program, the price, and all of that good stuff. If you have any questions, you can definitely email me, send me a DM, message me on here, whatever you got to do. I am on all platforms basically, except for Twitter. I'm not on Twitter, but I am on TikTok, I'm on Instagram and Facebook. So you can find me on those 3 platforms, and hopefully I get to chat with you soon. But if not, I will see some of you next week, or check back in next week for chapter 2, which is medical terminology for sterile processing technicians. All right, bye.